Hi, hunties! Surgery NPCs are finally in Maple Hospital, and I'm gonna show you everything you need to know about them. Let's go, hunty! This is everything in the surgery update. We can perform surgeries on tumors. With that comes 3 different levels of tumor removals and 3 different types of them: encapsulated, vascular, and fragile. We also get 4 new surgical tools, new surgery stats, and a steady hands badge. I'm so excited for this update, y'all. This is honestly one of the biggest updates in Roblox hospital game history. This is the first time surgery can be performed on both NPCs and real players. And Maple is going to be updating surgeries even more. It looks like in 1 week we're going to get appendicitis surgery. But for today, I'm going to show you how to work the new tumor surgery. Next. Z-Log, you always in here sick, hunty. What's wrong today, chill? Your stomach hurts and you're tired all the time? Oh my gosh, I think you got a tumor. Tumor and you need surgery stat or you gonna die. All right, hunty, now that I have you signed in, go ahead and come with me. I'm gonna take you to the ER, the emergency room. So go past the gift shop. And here it is. If you can just sit in bed 5 for me, that would be great. So just like you normally take care of patients, we're going to start off by getting vitals, temperature, heart rate, and we're going to go ahead and get your blood pressure. 120/80, perfect. So it looks like your symptoms with your tumor is stomach pain, dull ache, weight loss, and you're feeling tired/weak. We want to make sure Z-Log is as comfortable as possible. So we're going to grab a patient gown from the supply room over here. And then we need to bring him over to the MRI machine. I'm going to click on tools and grab a hospital bed. Your patient might automatically follow you to the MRI room, but because Z-Log is a real player, I am choosing to transport him. So the MRI room is here on the first floor. Go past room 107, go past the labor and delivery unit, and the MRI room is right here. It has this huge radioactive symbol, and it's room 105A. Oh my gosh, it looked toxic in here. Why is it all red? Am I dying, literally? Okay, so I have Zlog on this table here. It says insert bed into MRI by flipping switch in control room. So exit the huge room with the machine and then you'll see this panel here. It says insert bed. Insert. And now we need to activate the MRI by pressing start scan. Does it take away from my health if I go in here? Oh no, it doesn't. Hi, Zlog. He looks so happy to be in there. And now we need to get him out. So I'm going to press remove bed. And there he goes. It doesn't say to end the scan, but I'm going to end it so he stops getting roasted. Okay, I put Zlog back into this bed that I got from the tool section. But again, your patient might just follow you to that room. It really depends on if you're working with an NPC or a real player. But all these general steps are the same. The doctor has ordered treatments. No eating or drinking. Shell, he gonna be hungry. But I will go ahead and attach a saline IV to him while we wait for the doctor to review the symptoms. Y'all, I made a video giving my theory on how the surgery update would go, and so far I was pretty close. If you want to check out that video and see exactly how close I am, it's linked in the description. But I made pretty good guesses. We waiting for doctor. Okay, doctor has ordered treatment. Where the treatments? Oh, grab a blood sample from the supply room. Ooh, and I need to put on gloves. Here they are. I was about to get his blood without having on any gloves. That's disgusting. And now we're going to put it in the tube. I guess the doctors also need to review the blood sample. We're going to throw away our gloves and wash our hands. I think I'm going to grab a sandwich or something while we wait on this. Yum, yum, yum. Yum, yum, yum. Yum, 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 yum. His lab results are in. Oh, we have to wait for the doctor to diagnose. Okay. Print out the consent form. Y'all, it's happening. The consent form is brand new and it's part of the surgery workflow. Once it's done printing, pick up that paper. And what does it actually say? Oh my gosh, my character needs to stay still. Informed consent. It is your doctor's obligation to provide you with information. Something, something. Practitioner. Ugh, a bunch of legal mumbo jumbo. Hunty, I need you to sign this, Hunty. Thank you. Y'all, he just signed away his soul. He don't even know it. File in this brown box. Oh my gosh, y'all, I was so confused because the task box went away, but it's saying I need to start surgery. Do I start surgery on him right here? Oh, y'all, for some reason the task wasn't showing up, but I pressed start surgery and this popped up on him. I'm just gonna go ahead and transfer him up to the floor with all the surgery. Second floor. Honestly, this seems like a glitch. Usually tasks pop up telling me what to do next. Okay, I am gonna just bring him into operation room 2 and set him down on this table. Again, y'all, remember, surgery is on the second floor of the hospital. Second floor, and you have to be level 60 in order to enter this section. Once you enter, it's telling me that I need to scrub into the OR sink. So I see surgical scrub. I'm gonna go ahead and press it and then press E again to scrub in. Ooh, washy washy. And then get a sterile towel from the surgical cabinet and dry your hands. Maybe this is it. Once you enter the OR, go here, and if you just type in towel, it'll pop up. This is what it looks like. So once I have this towel, now it's telling me to put on a surgical gown. I'm gonna wear it because we are basically just trying to keep everything very sanitary. We don't want to give Z-Log some type of infection. Right next to it is the mask, and then the gloves are over here by the surgical cabinet. Period. I'm gonna open the surgical cabinet again and grab some clean sheets. My bad, that's a washcloth. I think these are the sheets. Yes, I'm gonna grab the sheets and put them onto the bed. Y'all, this room is bugging out a little bit. Let me try OR1. Okay, now it's saying to wait for patient to be brought in. Who is this? Who is this? Surgical nurse? Oh, Abigail's an NPC. I guess she's prepping Z-Log for surgery. Wait for Abigail to put the, ooh. Oh my gosh. Hi, my name is Abigail and I'm the surgical nurse. No lie, Abigail, you almost caught these hands. I thought you were a real player stealing my patient. So before we start the surgery, y'all, I just want to make it clear there seems to be some glitches, but if you just follow the instructions I've shown you, and if things start glitching with the sheets, just try a different operating room until it triggers the task again, okay? Now let's get started. Hi Z-Log, I am your surgeon Renee, and today I will be cutting out your brains. Grab a sedative from the closet. So we're gonna go back to the surgical closet in this room, and I am grabbing sedative. Push sedative into the IV stand. So that is over here behind Abigail. Pushing sedative, pushing. Next, we're gonna grab a saline flush from the cabinet. I just type everything in because I'm on PC and that's easier. And so I am back at the IV stand and I am pushing saline flush, pushing saline. Now he's getting sleepy. Z-Log's getting sleep. What is that she put on him? Abigail is doing too much. Abigail. He has like a tube going through his mouth. I guess that's the anesthesia. Now we're gonna grab a betadine bowl, got it, and place it on the blue cart. So it's this cart right here. Next, we're gonna grab the betadine bottle. So I have the bottle, it's saying fill the bowl. Y'all, this is so close to my prediction. Grab the sponge forceps back to the cabinet, soak the sponge forceps in the betadine bowl. We gotta put that brown juice on the sponge. It's brown. And then we are going to sanitize Z-Log's skin. This is all part of surgery prep. Abigail said, here's the scalpel, so I'm going to make an incision right now. It's a real mini game. Maple has outdone themselves. Y'all, I am making an incision. I guess we're burning off the blood vessels. You have to press and hold. Use the cautery to open the fat layer. These, you have to drag these. So see how I'm dragging my mouse? That's how you do that. Again, we are cauterizing the blood vessels. And now we are entering the muscle layer. Cut with the scalpel to go down one layer deep. Here's that muscle. Every time we are, get the hemostat and clamp the vessel connected to the tumor. And now we are cutting around the tumor. So the tumor is in this general area. I am going to take my scalpel, aka my mouse. Take my scalpel, aka my mouse, and just drag around. Drag, drag, drag. And now I have the forceps and I am actually ready to remove the tumor. So get the forceps and drag the tumor to the specimen container. Here's the tumor and I am dropping it. And now we're just gonna check for bleeding one more time. We don't want him to bleed out. Get the needle driver and suture the muscle layer. You guys, I'm not grabbing any tools. I am just clicking. So even though it says get the needle driver and suture the muscle layer, I never move from this spot. You can just stand here like I'm doing and just go through the motions. Anytime you see a dot and these lines, that means you need to drag your mouse. See, circle with lines. So we are going to drag. This is us pretty much closing this opening. See, we just got rid of the muscle layer and now we're suturing back up the skin layer. And to make him feel better, we're gonna get him a little bandage. Yes, we is. It already shows up in my hand. And so I'm just gonna press apply bandage and we are going to remove these tubes from his brain. And she will take him to Oh, she jumping. Where is she taking him? I'll take you to recovery now. She's taking him to PACU. Now it says send the tumor specimen to the lab through the tube system. Y'all, if you're like me and you have a million tools and you don't see the tumor anymore, press the 3 lines, go to inventory, and then the tumor is right here in this bottle with the blue lid. So the tube system is gonna be near the operation rooms back in the surgeon area. Go ahead and put a capsule and then drop the tumor into it. And then we are going to use the computer to log the outcome of the surgery. And we got it, the Steady Hands Award. So this happens after you complete your first surgery, y'all. Let's go check on Z-Log and see how he's doing. I saw you out of that bed. So here's our patient Z-Log. It looks like he's doing just fine. Is he? His heart rate is 42. His oxygen's 99. Y'all, I am so pleased and happy about this new surgery update. Maple worked really hard on it, and I can tell they put a lot of love, care, and development time into it. You will be catching me in the surgery room literally all week, and I can't wait until we can do appendicitis next. Down in the comments below, let me know what you enjoy most about being a surgeon and if the surgeon role is your new favorite, because honestly, it's mine. Bye, y'all.